morning, everybody. I'm Kristina Cheek, and I'm the founding executive director of SISTA GIRL Birth Initiative. And the mission of SISTA GIRL Birth Initiative is to improve Black maternal health outcomes in Valdosta and throughout rural South Georgia by providing prenatal and postpartum education, birth and postpartum doula support, and lactation education, fatherhood support, and also the other area of focus with SISTA GIRL Birth Initiative is influencing maternal health policy on the local, state, and federal level. As you can see here on this slide, this is my beautiful logo that I created last year, the second version of it actually. But in 2024, I started SISTA GIRL Birth Initiative after previously being with the state of Georgia. I previously worked with the Baby Love perinatal program, and sadly our grant was ended with the HRSA grant. And so I saw a gap in the community, and I said, I cannot let this happen. I definitely need to make sure that our Black mamas and Black babies and Black dads are taken care of. So that's where SISTA GIRL Birth Initiative started out, because of the poor perinatal health outcomes and the things that we face as Black families. I needed to start something on a community-based level that is for Black people, by Black people, to make birth and postpartum and family wellness a priority here in our area. Next slide, please. Okay. So again, our mission statement, I had some wonderful animation with these slides, but technology. But again, our mission statement is being a community-based organization dedicated to advancing birth and reproductive justice while enhancing the well-being of Black families through positive birth experiences. Oftentimes when I was meeting with my clients and speaking to them about their birth and pregnancy experiences, a lot of times they were telling me very negative stories of trauma, pain, fear, disrespect. And I just said there has to be a better way. We should be able to welcome our families and give birth with dignity, safety, and respect. And I made it my life's mission following the birth of my very first baby, and I went on to have 3 more. I'm a mother of 4. I made it my life's mission to improve Black maternal health. So that's that. Next slide, please. Yeah, I got animation. The vision of SISTA GIRL, of course, putting an end to Black women suffering from preventable childbirth-related fatalities. No woman in this day and age should be dying, all right, at the rate that we are. It is astonishing. Black women having the choice to breastfeed as the optimum method of nutrition for their babies to ensure the best outcomes at the beginning of their lives. It is unmistakable, unapologetic that breast milk is the gold standard for babies to be fed at birth and for as long as the mother feels is necessary for optimal nutrition for her baby. Historically, there have been a lot of efforts to undermine breastfeeding in the Black community. And one of the things that I want to do with SISTA GIRL is to rewrite that narrative and reclaim our birth and breastfeeding right to make sure that our infants thrive. And also here at the bottom, if I can see, making sure that Black fathers have become empowered and a valued part of shared decision-making and protection of his family. When we see Black fathers engage in the prenatal and postpartum period, and also engaging them preconceptionally, getting them prepared to be able to start a family, we see Black maternal health improve across the board in all areas. Next slide, please. Okay, so one of the things that I do, one of the things that I do is to provide childbirth education classes for Black women and, of course, men who want to come. And they are welcome to all members of the family and anybody that's in her support system. I don't care if it's her cousin, her best friend, her grandmother, it don't matter. Anybody that's going to be in this family circle that's going to be supporting them prenatally and postpartum, I love for them to come and get this information. It is critical that we learn how to care for a pregnant woman and make sure that she is looked after. And Black people are culturally a very communal people. And when we have that wraparound care, we see our outcomes improve significantly. So, and I offer these for free as well. Next slide, please. Again, Black babies need mama's milk. They need that chocolate milk because we know that Black babies are healthier. They have a much better chance of surviving. Where in the Black community, prematurity is really a problem when we have babies that are born way too soon at very low birth weight. Breast milk is the gold standard for making sure that these babies grow and they reach their milestones and that they are healthier and not succumbing to illnesses that frequently plague Black babies when they're born premature and at low birth weight. So again, I offer free breastfeeding classes in person and virtually as well at no cost. If you ever see me at South Georgia Medical Center, you'll often see me up there with the pump, delivering pumps to moms in the NICU at free of charge. And, just making sure that they have all the tools that they need to give their babies their chocolate milk. So next slide, please. And of course, Black fatherhood. My goal, like I said, is to make sure that Black fathers have all the tools and education that they need in order to have shared decision making in this process. A lot of times, men, and it doesn't mean it, regardless of it being a Black dad or Hispanic dad, white dad, a lot of times men will tell you that they often feel kind of left out of the pregnancy and postpartum process, and they don't know what's going on. But the truth is, when men have the information, they often want to help. Men love to know what to do, and when we give them something to do, they do it well. So I teach them how to advocate during the pregnancy and postpartum period, what questions to ask when they go to the prenatal visits, how to advocate in the hospital, how to care for the baby after the birth of the baby, and how to care for mom, and most importantly, how to care for himself, because fathers also experience pregnancy and postpartum. 1 in 10 fathers experience postpartum depression, but it does not get talked about. And so we need to make sure that they are brought into the fold and embraced fully and looked after as well. And once he is healthy, he is kind of the umbrella for the Black family. And again, we see families thrive. Next slide, please. So I also provide resources. You'll often see me passing out free diapers. And last year, I was very fortunate to get some donations for car seats and bassinets. That is one of my biggest requests. I cannot tell you how many times I get calls from the hospital to help a mom who does not have a way to get her baby home because they do not have a car seat. So I'm definitely seeking donations and sponsorships for that. If y'all know any resources, please help me out. Please pass them my way. I also give out perinatal care packages, which contain things like a manual breast pump, a blood pressure monitor, urine test strips, positive affirmation cards, information about prenatal care, postpartum care, breastfeeding, all the things, compression socks, a belly band, all the things that a mom needs to have for a safe and empowering pregnancy and postpartum experience. So, and also I love setting up at booths and community events, and I try to have culturally congruent prenatal and postpartum education, mental health resources for Black women. And I try my best in any kind of the literature I hand out to make sure that it is culturally congruent, so that they see themselves in the material that I'm handing out to them. Next slide, please. Okay, let's talk about these statistics. Black women are 3 to 4 times more at risk of dying before and after childbirth. And what's even more sobering is that more than 80% of these deaths are preventable. 1 Black woman dying in childbirth is way too many. All right. We should not be sending families home without the matriarch. Okay. And also, no mother should go home without her infant in her arms. With all the technology and all the advances in healthcare that we have, we got to fix these stats. Next slide, please. The Georgia maternal mortality rate right now is 32.1%. And again, like I said, 80% of those are preventable. One of the ways that we can prevent those statistics from climbing is by providing Black doulas for Black mothers. I am a proud doula. I've been a doula for about 16 years, and I can tell you the benefit of a doula is amazing. When women are supported by someone who looks like them, no matter of their choice of how they want to give birth to their baby, unmedicated, unmedicated, medicated or unmedicated, at home or hospital. When they have doula support, we see these moms have a much more satisfying birth experience. We also see the cesarean section rate go down significantly, the need for pain medications, the cascade of interventions that usually happen to Black women are significantly decreased. So that's the way that doulas impact the maternal health care system. Next slide, please. And again, the infant mortality rate amongst Black babies born to Black women is 1.5 times higher than a state rate. Okay, look at those statistics. This is all information according to the March of Dime. They recently released a report in 2024. The data lags a year behind in 2023, but in 2023, our preterm birth rate was at an F. Okay, we have 11.9% of our babies born premature and at low birth weight. We got to fix that. When we have food deserts in our communities, when we have transportation barriers, when we have a lot of information that is incorrect, when we don't have culturally congruent and evidence-based maternal healthcare education, these statistics are going to unfortunately get worse. Next slide, please. And so how am I fixing this? I talked about how I do this on a community level, but do not get it twisted, y'all. I put my boots on the ground and I am at that Capitol making it happen, okay? One of the ways that I definitely know needs to happen is I could talk, until I'm blue at the face at the hospital and this, that, and other, but the real change needs to happen at the state level, all right? So I try my best as much as I can during the legislative session, which is from January to April, to be at the state capitol advocating for maternal health in rural South Georgia. There are focus, of course, on a statewide level, but I try my best to amplify what's happening here in South Georgia because we have different needs and concerns in this area that is different from Metro Atlanta. It's different from the Macon area. South Georgia is its own kind of thing. And so I want to make sure that they hear us down here and they know what our moms and our families need. Next slide, please. So some of the bills that I have been advocating for are as follows. On the federal level, we all know about what they call it, the Big Beautiful Bill. I call it the Big Ugly Bill. House Resolution 1, this is on a federal level, the one that Trump recently signed into law. This is going to be catastrophic for us, all right? But all hope is not lost. Over 17 million people in the United States receive Medicaid. In Georgia, over 50% of our births are covered by Medicaid. A good chunk of those people that are receiving those benefits are going to be cut off from access to care. And when we see people lose access to care, of course, our maternal health outcomes are going to worsen, okay? When we have funding cuts to maternal health care programs at the state level, whether it be from the Department of Public Health, community-based organizations and clinics like Planned Parenthood, and things like that, it's going to definitely trickle down, but it's always going to be worse for Black families because we're already at a disadvantage. On the Georgia state level, House Bill 520, which is the Georgia Licensed Midwife Act, this is basically a bill where I've lobbied to get licensure for all midwifery paths to be able to legally practice their craft in the state of Georgia. Why this is why this bill is important is because it gives more women choices to who they want their birth attendant to be, and also affects where they can give birth. Right now in the state of Georgia, only certified nurse midwives are legally able to provide services at a hospital. But we are seeing an increase of Black women wanting to have home births. The statistics also show that when Black women are attended by a midwife, whether it be a nurse midwife, a traditional midwife, a certified professional midwife, Black women have much better outcomes than if they were attended by an obstetrician or an OB/GYN. The rate of cesarean section goes down, episiotomy, hemorrhage, and all the things that affect Black women that cause the maternal mortality rate improve when Black women are under midwifery care. Also, this bill will allow midwives to practice in more regions throughout the state and be able to fill in the gaps in those maternal health care deserts that are very common around the state outside of the metro and Atlanta area and Macon. Most of the state is very rural. And so if we make it where midwives can legally practice, we can increase the perinatal workforce and incentivize it so that midwives are able to practice their crafts and meet that need. Also, House Bill 441, this is the Georgia, and somehow I keep on getting a pop-up screen, y'all. I'm so sorry. House Bill 441, Georgia Prenatal Equal Protection Act. What this bill was it was led by 6 Republicans, and basically it declared abortion illegal once there was a heartbeat detected. Most women do not know they're pregnant before 6 weeks. And by the time they find out, it is already too late for them to make a choice. Why this bill is dangerous? It's because there are some health conditions where the mother may need to have her pregnancy terminated to save her life. This is an ectopic pregnancy where if an ectopic pregnancy progresses, it can kill her. If she is having a miscarriage and if she does not get all of the fetal tissue out of her system, she can then become septic and lose her life. And in the case of Amber Thurman, I don't know if you've ever heard about her in the news. She was one of those victims where she needed life-saving care, but she was unable to receive that care that could have saved her life because her care providers kind of had their hands tied behind their back, trying to figure out if she fit the criteria for them to be able to give her that care without fear of litigation or them losing their lives. When women are unable to make choices, we are going to see them making choices kind of behind closed doors that may not be the safest for them. This is also going to affect the in vitro fertilization access for Black women. Black women have unique challenges when it comes to fertility. And so this bill is going to be this is definitely going to affect their ability to be able to make choices about how and when they can start their families. And lastly, the House Bill 925. This is the creation of a Georgia Momnibus Act. The Momnibus Act is actually a federal piece of legislation. It's a set of about 13 bills that it's packaged like a major maternal health care bill, and it gives improvements in areas of community-based organizations, making sure that women have access to different care providers, making sure that Medicaid access is secure, making sure that Medicaid providers are adequately reimbursed and at a good rate, so that care providers are not denying Medicaid providers care. One of the biggest reasons why a lot of care providers aren't taking Medicaid is because the reimbursement rate for services is so low. So the way we fix it is definitely recompensate these care providers at a decent rate, That way they'll continue to accept Medicaid, because again, the majority of Black people receive Medicaid. So if they don't have access to care providers, guess what? They're forgoing prenatal and postpartum care. Next slide, please. So again, the One Big Beautiful Bill Act is projected to have a detrimental effect on rural communities, especially for Black women. Again, with hospital closures, reduce access to care, transportation barriers, funding for community-based organizations is at threat. We definitely got to keep our eyes open and stay on our toes and continue to advocate and lobby. And even for us who are not having children anymore, we're past that stage. If you are decide not to have a parent, this still affects you, because your sister, your grandchildren, your cousins, anybody in your circle may be wanting to start a family. So we need to have all voices and all people on deck to advocate and talk to our legislators about maternal health care in rural South Georgia, because it affects everybody. Next slide, please. So some of the wins. Last year, Black Maternal Health Week was recognized by the city of Valdosta for the very first time. This is us last year when I had longer hair. My hair was done, y'all. With the city of Valdosta, this was a very proud moment, and I was so happy to have Dwayne Johnson, of course, there to support the proclamation as well. I think he was the photographer in this picture, but this is definitely going to be something I continue to do. So make sure you stay in the loop for Black Maternal Health Week Proclamation 2026. Next slide, please. And again, like I said, and you'll hear Dwayne and Tommy Beth say, hey, this girl is everywhere. And yes, I am everywhere, because you have to show up. If you want your cause to be noticed and picked up, you got to show up. So becoming a stakeholder, giving a voice to South Georgia and maternal health. I was fortunate to recently be accepted to the Hope for Georgia Moms Maternal Health Task Force, representing Valdosta. Also with the Black Mamas Matter Alliance in the middle. I just recently on Monday attended their Georgia Maternal Health Task Force stakeholders meeting, and making sure I'm amplifying the needs of South Georgia and our birthing families. And of course, I am an advocate. I do not apologize for what I do. Next slide, please. And I just want to highlight the power of collaboration in the Southern Georgia Black Chambers and how it relates to maternal health. Dr. Clarissa Alderman, she is a therapist and owner of Family Insight Therapy. She has a lot of commas and dashes behind her name, y'all. But if you know Dr. Alderman, you know she is the bomb, and she is a woman of power. She gets stuff done, and she is about her business. And so I called on her to be a sponsor for a business pitch for one of the doula cohorts that I'm a site coordinator for. And one of our cohort members did a business pitch, and Dr. Alderman was very generous to donate $1,000 for the winner. And so this is a picture here of Dr. Alderman with our winner, Tara Goodman. She's out in the Albany area. So we have a far reach, y'all. The power of collaboration is SGBC is out there. So Dr. Alderman came all the way to Albany, Georgia, and Austria Johnson, okay, of AJ Produced It, came out to do the photography. That was actually her second event that she did with the Georgia Black Doula Network. And so we were looking for a photographer. I said, y'all, I know somebody. And so I called on my girls in the chamber, because again, I want to keep that money flowing in between the chamber members. This is the power of collaboration, y'all. And it is amazing when we work together. We're always stronger together. Next slide, please. So that's it. That's all in a nutshell. There's a lot more that I could talk about, but if you want to know more, if you want to sit down and wax poetic about it, please contact me. This is my phone number, my email, and you can always hit me up on Facebook. If you stop me out and about, let's talk, let's chat, and most importantly, let's collaborate, let's grow. Thank you.